Our main talk today will be a talk that will speak to your heart. Actually, about your heart, excuse me. We are honored to have a few medical professionals here in the community, and one of our well-known medical professionals is Dr. Richard Andrews, who today will be presenting Oasis Med School Day Number 2, The Heart. Oasis, please welcome Richard Andrews.
I'm going to see if I can get this technology set up here. So, how many of you were here for Med School Day Number 1? Okay, well, hopefully you are ready for the quiz. That was cheating, you weren't supposed to see that. Let's see here. Okay, so this is a series of short talks about different parts of the body, basically. And I found this beautiful piece of heart art online there. Here's a little bit about my own background. After you hear all the talks, you can apply for a medical license, although they probably won't give it to you. That does not prevent lawsuits, but my license doesn't prevent lawsuits either. And then there's the consent form. Don't read it too closely. And then, as you know, I enjoy talking about the different word origins. That can be helpful as well as interesting. So we're going to be talking about, among other things, the different chambers of the heart. As you may recall from high school biology, there are 4 chambers of the heart, 2 little ones and 2 big ones. And the 2 little ones are called the atria, or singular atrium. And that's another word for, I like to think of it as the entry hall for the heart, because that's what they do. And then the ventricles comes from the word from the Latin for small belly, because they think of the belly as an empty little thing, and then so this is like a small cavity in the heart, you might say. Although they're larger than the atria, the ventricles are larger. Coronary arteries. Some sticklers will say that you have coronary arteries and cardiac veins. That there are no coronary veins. There's some quibbling about that, but the reason they make a distinction is because the word coronary really comes from the Latin word for corona, and so some of the early anatomists felt that the arteries form a crown around the heart. You have to have an imagination when you look at this. And the cardiac veins don't, so that's why they call them coronary arteries, cardiac veins. But you can call them coronary veins, nobody really cares. So, and then myocardial, you'll hear that term. For example, the term myocardial infarction is the official word for a heart attack, but they mean the same thing. So my meaning muscle, and card meaning heart, so that's myocardial. And then the vena cava we're going to hear about pretty soon. Vena cava means the vein that looks like a cave, basically, or the empty veins. All veins are empty, of course, when they don't have blood in them. But the vena cavae are the large veins that bring blood back to the heart. And we're going to see pictures about that. Here's one of the pictures here. So blood isn't really blue, of course, except on me. You can see it. But the low pressure, low oxygen blood, I hope this is more or less not very good resolution, I apologize. But on the right side of the heart, which is the low pressure, low oxygen side of the heart. Thank you. Low oxygen, low pressure side of the heart is the right side, and so blood comes back into the heart from the upper part of the body and the lower part of the body into the right side of the heart, into the entry hall or the atrium of the heart on the right side. And then we'll follow the distribution of the blood after that. And then the red vessels are the arteries, so that's the blood going away from the heart to be distributed to the rest of the body. Hopefully I won't get too much feedback here, except at the end of the talk.
We got
So what's its job? Well, sometimes people get aggravated with their heart for other reasons, but it's really supposed to just pump blood. It's not generally under voluntary control, which is a good thing. You don't want to wake up in the middle of the night and your heart stopped because you forgot to tell it to pump. So it's basically an automated system. Some yogis, as we've heard, can make their heart slow down, but you can make your heart slow down by just relaxing and, you know, contemplating your navel, that sort of thing. So it pumps about 6 liters a minute. You can't really talk about the heart without talking about the blood vessels, because of course they carry the blood that the heart pumps. There's no really good scientific estimate of how many blood vessels there are in the body, but somebody estimated 60,000 miles or 100,000 kilometers. The circumference of the Earth is about 40,000 kilometers, so you can see that it really is a lot, although like I say, it's a little bit dubious how accurate that is. But like I say, you can't really talk about the heart without talking about the blood and why we need to pump blood around the body. Well, blood has several roles. Perhaps the most important is carrying oxygen and disposing of carbon dioxide. We're the opposite of plants. Of course, plants take in carbon dioxide and give off oxygen, fortunately for us, and we do the opposite. So, but the blood also delivers nutrients and hormones and is part of the immune system, and so the heart is pumping that everywhere. And where is the heart exactly? Well, most of us have heard somewhere that the heart is on the left side of the chest. That's sort of true and sort of not true. Strictly speaking, the heart is in the middle of the chest. The left side of the heart, remember we talked about the right side being the low pressure side of the heart. So it's smaller, it doesn't need to be as big as the left side of the heart, which is the high pressure side of the heart. And like any other muscle that you use, not enough, but like any other muscle that you use, if you use it more, or it's under more pressure more of the time, it needs to get larger. And that's why the heart extends over, and we'll see pictures here in a minute. The heart extends over to the left side of the heart, but a portion of the heart extends over to the right side as well. And because the heart extends over to the left side, the lung has to make room for it, so your left lung is actually a little smaller than your right lung to make room for the heart. And here's a standard chest x-ray. You can see you can see the heart shadow here. Again, I apologize for the resolution. It looked better at home. But you can see the heart shadow. X-rays are basically shadows, interpretation of shadows. And so you can see that the heart is in the middle of the chest, even though there's more bulk on the left side. Here's another picture from the side view of an X-ray that again shows the heart more toward the front than it is toward the back. So it's in the middle of the chest, but it's sort of in the front middle. How big is your heart? It's a little bit bigger than your clenched fist, roughly the weight of an apple. And it's bigger in athletes. Again, when there's more demand on the heart, like any other muscle, it must get larger. Sometimes that's an appropriate adaptation. Well, you could say that it's always an appropriate adaptation. It's necessary, but sometimes it's therapeutic and sometimes it isn't. If your heart gets too big, and some of you will recover, at least those of you who are my age will remember the name of Len Bias, who was a famous college basketball player many years ago. Looked like he was headed for doing very well. Pete Maravich is another example of a basketball player. These athletes at that level virtually always have big hearts because they're putting a big demand on the heart. And when the heart gets too big, it can outstrip the efficient functioning of its own electrical supply. Because the heart generates its own electricity, and so that can cause trouble. So I'm not saying don't be an athlete, because that's a rare condition. The giraffe heart, my brother pointed out to me, is 25 pounds. And then the blue whale heart, well, don't worry, there's not too many gross pictures, but that's one of them. There's the heart in the hand. That person should be wearing gloves. And I'm going to briefly step away from the heart topic to talk about plastination. Some of you will have heard this term. Some of you may, in fact, have seen either in Houston or elsewhere I think it's called Body Works. I think they have various different names for it, but these plasticized bodies. Plastination is a technique that was developed in 1977 by a German who developed a technique for removing water and fat from the body and then replacing it with plastic. In the case of the blue whale, it took a year to do that. We'll see a picture of the blue whale heart in a minute. But it shows you remarkable detail in the body and even remarkable function. If you haven't seen one of these Body Works exhibits, they tour around the country and they're in Houston periodically. They're stunning. You really have to go. You will learn about the body. So here's a plastinated heart. The heart, again, has 4 chambers, the 2 little ones and the 2 big ones. Here's the blue whale heart, plastinated. That's a real blue whale heart. Kind of a sad story. 9 blue whales got trapped in ice up in Canada and they died. They said those 9 blue whales represented 3% of the wild population. Pretty sad. But they took advantage of it to find out more about the anatomy of the blue whale because not very much was known. Here's a diagram of the heart, and really all mammal hearts are pretty similar. So you have the blue side is the low pressure, low oxygen side of the heart. These are the vena cava. So this is the blood returning to the heart from the upper part of the body. Here's the blood returning to the heart from the lower part of the body. Comes into the entry hall, the atrium. There's 4 chambers in the heart, and so there are 4 valves in the chart. This valve, this valve, this valve, this valve. This is an easy medical school, so you don't have to remember the names of the valves, don't worry. So the blood comes into the right atrium. There's a contraction or a squeeze of the heart. The blood then goes from the right atrium into the right ventricle. It's still a low pressure side of the system, but it's a little bit higher pressure now because the right atrium, the little entry hall, gave it a squeeze to raise the pressure up a little bit to help the right ventricle. The right ventricle squeezes together with the left ventricle, and then the blood goes out this valve to the lungs. Because remember, this is the low oxygen side of the equation. And so we have to get more oxygen in the blood, so it goes from the right ventricle to the lungs, picks up oxygen, gets rid of carbon dioxide. They're both important, right? And then when we breathe out that carbon dioxide. And then the blood comes back into the other relatively low pressure side. And now it's a little bit higher pressure, but it comes back into the left atrium, which is the entry side on the left side. And when the heart pumps, the blood comes through into the left ventricle, which is the really big part of the heart. This is where the bulk of the heart is right here, and that's why it extends over to the left side. And then when this ventricle squeezes, then the blood goes out through the aortic valve up to here, and we'll see pictures of the aorta later. So when it leaves the left side of the heart from the left ventricle, it's getting distributed to the rest of your body. Does anybody know what this is called?
A miter.
A miter, very good. A bishop's miter. M-I-T-E-R. Now that seems like a different topic, but it turns out it isn't. When we go back to here, we see, remember there's 4 valves, 1, 2, 3, 4, and they're all 3 leaflet valves, so they close like that, except the mitral valve, which has 2 leaflets. And the reason it's called the mitral valve is because somebody decided it looks like a bishop's miter, which, as you can see, has 2 leaflets. You see, that's where the word mitral comes from. Like you've heard of mitral prolapse, for example, some of you. So electricity in the heart cells start beating at a few weeks old. By the way, I should mention that I didn't time this talk, so make sure that I don't run over my time, somebody. The heart generates its own electricity, interestingly enough. Although there are other things that influence the heart rate. For example, hormones influence the heart rate, even nerves influence the heart rate. But even if none of those are present, the heart will still be generating its own pulse, which is automated. And it's a good thing, like I say, because you want it to keep pumping. So the electrical impulse, or push, starts in the right atrium. And it starts in the little chambers because you want the little chambers to pump. Remember I said they pump first, they pump blood to the big chambers, then the big chambers pump them out. So it's a sequential contraction of the heart. You want them to go in sequence. When they go out of sequence, bad things happen. And there's a sort of an inborn rhythm of those impulses. Here's an EKG. Some of you have had EKGs. Most of you at some point will have an EKG, electrocardiogram. And when you look at this, this is basically, an EKG is completely passive. It's basically a tape recorder for the heart. It's just listening to the electrical impulses of the heart and then displaying them graphically. So this is the electrical impulse related to the contraction of the little chambers, and then there's a little bit of a delay while the blood goes from the little chamber to the big chamber, and then you get the electrical output related to the contraction of the big ventricles, and then you get the relaxation phase, or when the electricity has to reset itself to get ready for the next beat. And so this is what's called the depolarization phase, or getting ready for the next contraction. So that's what an EKG is. And here's when we're looking at, this is when you're just looking at a single beat in a single location. Here's when you're looking at, it is very useful. The reason EKGs give us so much information is because the leads that are attached to the heart are attached at various different locations around the chest, and we can correlate the different parts of the heart with the different leads here. You see how all of these have approximately the same pattern that we discussed before, and then depending on where the little squiggles are, it tells us things like whether the person has had a heart attack or is having a heart attack right now, and that's or whether the rhythm is regular. You can see that the rhythm is regular here. This is a regular rhythm. So let's see here, and then blood flow in the heart. We talked about that. Low oxygen blood. Again, it's not that everyone's blood is red. It's just that sometimes if you don't have much pigment like me, then it looks blue just because of the way the light diffracts. And the more aristocratic you are, apparently I'm aristocratic, which is embarrassing. But anyway, they were called blue bloods because they didn't work out in the fields. They didn't get tanned, so their blood looked more visibly blue than somebody who has darker pigment. That's where the term blue blood comes from. And there it is. Okay, so we talked about this again. The heartbeat and the heart sounds. When the doctor listens to your heart with a stethoscope, we're listening for, and doctors used to put their ear directly on the chest before stethoscopes were developed, but that was deemed immodest, and so they developed the stethoscope. Also, I suppose when somebody has an infection on their chest, maybe you don't want to put your ear right up on it and stuff like that. You all know about blood pressure measurements where you have an upper number and a lower number. Your upper number should always be higher than your lower number or you're dead, basically, or about to be. And so when the heart squeezes, that's called systole. When the heart squeezes and the blood comes out the aorta, we're going to see a picture of the aorta here in a minute. And then the blood goes to the arm where we typically measure blood pressure, although you can measure it in other places. And when we measure that highest number, that correlates with the contraction of the heart. When the heart then relaxes and blood is flowing into the heart to get ready for the next contraction, that's the low pressure side, and that's when you get the diastolic blood pressure. Normal blood pressures, people argue about that, but basically you want it to be under 140/90, and if it's a little bit lower than that, that's better. So the first heart sound, when you listen to the heart, now sometimes you'll hear murmurs and various other things, and some murmurs are bad, some murmurs are normal. If you have better hearing, you'll hear more murmurs than if you have bad hearing, obviously. So, but the normal, so-called normal heart sounds are S1 and S2, sound 1 and sound 2, you could say, and those sounds are related to, they're both occurring in systole, they're both occurring when the heart is squeezing, and that's when the different valves that we saw are closing. Those are the heart sounds that you hear. The left ventricle pumps blood to the whole body except for the lungs. We saw that the right ventricle, in fact, is pumping blood to the lungs. It's specialized at doing that. The aorta, which we'll see a picture of in a minute, is the largest artery in the body. It carries blood upward and then starts to curve down. The smaller arteries begin to branch off and then get smaller and smaller and smaller. Here's a picture of the aorta as it leaves the heart. My mother, who had high blood pressure and high cholesterol, a number of years ago, she had what's called a dissection of the aorta, where you get a false channel. The blood thinks it's going to the right place and it isn't, and that's an emergency, and she had to have emergency surgery, which she tolerated relatively well, long story. When the blood comes out of the heart, the first priority is to feed itself. It has to give blood to itself. And so that's why you see these blood vessels here, the coronary arteries. It's kind of an odd concept that the heart has to pump blood to itself, but it does. And then when you see this is called the arch of the aorta. You saw that on the x-ray, actually. It's another shadow. And then you start seeing the other blood vessels going off to the different parts of the body. So when the blood vessel comes over here, this is where we measure it in the arm, right? Because that blood's going to the arm. And one of the first priorities also is the blood going to the head, because the brain uses a lot of oxygen, a lot of blood. Here again is that picture of the overall flow of the blood. And arteries and veins, people often get those confused. The best way to think of arteries and veins is A for artery, takes blood away from the heart, and the veins are the other ones. Let's see here. So as the arteries get smaller and smaller and smaller, carrying oxygen and nutrients and hormones and so on, then they eventually turn into capillaries, which are tiny, and they're all over the body. And that's where the gas exchange and the nutrient exchange occurs, at the level of the capillaries. So arteries get smaller and smaller and smaller until they're tiny. Here's where the oxygen exchange occurs, and then they go into the veins. The capillaries turn into veins, and then the veins get bigger and bigger and bigger as they're going to the right side of the heart, the low pressure blue side of the heart, to get back to the lungs and pick up oxygen and get rid of carbon dioxide. So here's a couple interesting factoids. 3 to 4 orgasms a week, if you can manage that, reduces the risk of heart attack in men by half. It's unclear if there's similar benefit in women, but I'm sure there's active research in that area. Now that's a bit of a joke, but see, for the longest time, and we've all heard this, most of the research that was done and much of medicine was on men, and so we learned more about what happens to men. And in women, for example, when they started doing more research on heart disease in women, for example, they found that frequently symptoms of a heart attack are different in women than they are in men. Now, there's a great deal of overlap, of course, but we have to have a low threshold of suspicion when we're with a woman to see, who's describing, for example, nausea or shoulder pain or different things, to make sure that we're not missing a heart attack in somebody. And erectile dysfunction. Now, this doesn't mean that everybody with erectile dysfunction is about to have a heart attack. I don't want to cause a heart attack, after all. But if you do have erectile dysfunction or know somebody who does, then they do need to get their heart evaluated in case that's an issue.
Speaking of which.
Oh.
Sorry.
Heart attack. Let's see here. Okay. Heart disease, we don't have time, I think, to go into a great deal of depth for heart disease, but the most common kind of heart disease is coronary artery disease, CAD, blockage of the heart arteries. And when the coronary artery gets blocked all of a sudden, then that causes a heart attack, because now you're not carrying oxygen to that part of the heart. My father had a heart attack, for example, and as is rather common, he had a silent heart attack. He had no idea that he had a heart attack. Now, he could be oblivious sometimes anyway, but his heart attack was picked up sometime after it had already healed. It just showed up on an EKG, basically. Because heart attacks can be mild, they can be severe, it can be sudden death. The causes of heart disease, partly genetic, of course. If you have a strong family history of heart disease, then you do have an increased risk, but it's still not inevitable. How am I doing on time, by the way?
Jesse.
Okay, so blood pressure is one of the biggest factors. Remember, if we have high blood pressure for various reasons, including diet, excess weight, things like that, then the heart, in order to successfully pump to the body, it has to get bigger and stronger in order to pump against that higher blood pressure. But as we've seen, if the heart gets too large, then it starts to cause new problems. Smoking, of course, is one of the biggest risk factors for heart disease. Diabetes, excess abdominal fat. I say excess abdominal fat because abdominal fat is characteristically different in its behavior than fat anywhere else on the body. Butt fat and arm fat and other kinds of fat, thigh fat, that will not generally affect your health. The abdominal fat is very metabolically active, and that will affect your heart health and risk for diabetes and blood pressure. Abdominal fat is different. And physical inactivity, of course. A heart attack or myocardial infarction is basically, by definition, it's when a piece of tissue dies. We only use the word infarction, which means death of tissue, when tissue has died. And heart tissue generally cannot regenerate, unlike the liver. If a piece of your liver dies, in fact, we can chop out half of your liver and it will grow completely back. The liver is much more resilient. Here's pictures of gradual blockage of arteries in the heart. The first two, you do not have any symptoms. There's basically no problem whatsoever with those. The third one, you're starting to have symptoms if you're lucky, and then the fourth one, you're in trouble. So, fake heart attack, don't do that here. I'm not on duty right now. Here's a couple of little interesting things. Monday morning is the most common time for heart attacks, just like you might expect. And then Christmas Day, because there's a lot of stress associated with Christmas, there's also a lot of overeating and overdrinking and various other overs. And as far as heart disease prevention, I would say the most important thing is know your numbers. Now, everyone knows you're supposed to know your blood pressure and your cholesterol and your triglycerides. What's a little bit less commonly known, and we're going to do a test at some point here at Hope Clinic. Here at the Oasis, we'll do free diabetes testing at some point in the future when I can get that organized. Now, of course, checking your blood sugar is helpful, but you can fool people with that. Of course, if I just check somebody's blood sugar, patients nearly always will eat very healthy for the 24 hours before they come see me. And lo and behold, their blood sugar is normal. But I have a secret test, which is the 3-month blood sugar average. And it doesn't care if you ate 5 minutes ago or you've been fasting for a week, it doesn't care. It looks at the blood sugar average for 3 months, and that's a very useful test. And everybody in this room should know their HbA1c, or if you don't remember that, remember your 3-month blood sugar average. Everyone should know that. Healthy behaviors, make healthy behaviors, easy behaviors. What I mean by that is if you rely on going to the gym to do all your exercise, then you're probably not going to exercise that often. If you have a little step stool in your house and every time a TV commercial comes on, you do your step stool, or you keep the small weights in the living room and every time a commercial comes on, you have to do the small weights, then that's an example of building healthy behaviors into your routine. People will always say, well, it's too hot, it's too cold, it's too dry, it's too wet, no matter what, it's too dark, it's too light, you know, there's always some reason why we're not going to exercise, right? So if you smoke, it is the leading preventable cause of death. There's a free phone number there, paid for by the tobacco companies. They didn't want to pay, of course. They paid billions into this fund, so we want to make sure they use that up. And these people will send you free nicotine patches in the mail in order to help you quit. E-cigarettes are mildly controversial. I personally recommend them if somebody's having trouble quitting smoking. It's basically water vapor and nicotine. Nicotine is not harmful for you by It's the addictive component of cigarettes, but nicotine by itself doesn't really harm you. If you're addicted because of nicotine and then you're sucking smoke into your lungs, then that's the bad part. It isn't the nicotine per se. So I recommend e-cigarettes if somebody's having trouble quitting. And that's about it. So, any questions? Cardiac. No, I don't think I can. It's either Latin or Greek, and that's about all I can tell you. I think it was because card players would get a heart attack sometimes when they got bad cards. You know, that's about all I can tell you. Yes, sir.
Yes. My dad has had a stent. My uncle, his brothers had a stent. My great-grandfather died of a sudden heart attack. My grandfather was 10 years old. That's just my dad's side. My mom's father died of a sudden heart attack at age 74, 2 years before I was born. Her brother has had two mild heart attacks. My question is, how about my genetic history? I'll be 41 in a few weeks, and what's the absolute maximum amount of red meat I can eat? I'm trying.
You can eat this much red meat. And no, as far as your great-grandfather and even your grandfather, your genetic, the amount of genes you share with them is really not very large. So I wouldn't worry about that too much. Your grandfather to a certain extent, but your great-grandfather definitely has no bearing on it. Somebody having a heart attack at 74 is also not considered a high-risk factor. That's, it's not quite normal, but it's not considered high risk either. If you have family members that have had heart attacks under 55, that's when we start paying more attention. Or in women who generally have, women are actually protected against heart attacks when they're still menstruating. Once they hit menopause, then the risk of heart attack rapidly catches up to the risk of men. Now I realize you probably haven't had menopause yet, so that's not really an issue. But as far as individual stuff, we can talk about that later. But I would say certainly know your numbers. Know your numbers. Yeah. Yes?
Yeah, I've got the mic. You mentioned that in smoking it isn't nicotine that's the real danger, it's inhaling the smoke. Does that mean that alternative tobaccos also have that same risk, or is that different? Asking for a friend.
I'm not sure what an alternative tobacco is, but maybe like THC or something like that. Would that be an example?
Sure, why not? I'll say sure, go with it.
Yeah, okay.
One more question?
So marijuana, well, I'm still
Do
on.
you smoke 20 joints
question.
a day? I mean, that's...
So, well, we could do an experiment. That's
We got the summit coming up in Denver.
Yeah.
July 29th.
Yes, sir.
Let me get you the mic first.
Oh, I'm sorry. Well, I would say that in general, less is known about things other than tobacco. Tobacco is one of the most studied substances there is, and so we know a huge amount, despite what the tobacco companies tried to make us believe for decades. There's a huge amount of evidence showing that there's a clear connection between smoking tobacco and heart attacks. When people smoke joints, for example, they don't typically smoke 20 to 40 joints per day. Now, there are some people who do, but most people don't. And so I would say, even though it's not a good idea to suck anything that's burning into your lungs, I would think that as far as we know, the risk is less, but not zero with other substances. Yes, sir.
A couple of weeks ago, one of our nighttime comedians had a child, and you might explain to some of the people that what this tetrahydrogenol is, so that if they're interested in knowing why his child had a problem.
Sure. Tetralogy of Fallot is a genetic disorder. It's basically when you have the blood vessels coming out of the heart connected to the wrong chambers. There are multiple different variations of the condition. It can be quickly fatal for obvious reasons, and it's sometimes associated with other heart abnormalities, but it's something that typically has to be corrected early, and sometimes it is fatal.
And that's in reference to Jimmy Kimmel's.
I didn't hear the story, but
The comedian Jimmy Kimmel's child was hospitalized right after he was born, and he called out President Trump for various healthcare reasons. So. Another question?
Actually, I think that's all we have time for.
That's all we have? Okay.
Sure, you have the today.
Yeah.
Maybe I have some more questions for him. Thanks, guys.